breast implants aren't meant to last forever. So both saline and silicone have a very similar silicone shell, and ruptures can occur from friction, from wear and tear. It's pretty analogous to a situation like if you're wearing the same pair of jeans every day for 10 years, you'd probably get a hole in the knee at some point. And that's the most common mechanism of why people get implant ruptures. The main difference between saline and silicone is the saline, when it has a hole or rupture, the fluid, which is essentially IV fluid in that bag, it'll leak out so that that patient will see a size change, basically like a flat tire. It'll be flat, but sometimes it can be a partial leak where it's more subtle than that, but usually they do see an appearance change. Now with silicone, it can be different because the gel that is in the bag, it's very cohesive and it acts like a solid, not like a liquid. In the past, they were fairly liquidy and oily, but now the gels are made cohesive. So if you had a hole in the bag, the gel doesn't easily come out. So there can be absolutely no symptoms of rupture. And so the FDA does recommend MRIs of the breast starting about 5 to 6 years post-op and every 2 to 3 years after it to check for rupture. But ruptures, they're not dangerous. And so we just recommend that when there is a rupture that a woman takes the time to have surgery to change the implant out.